New research has discovered a combination of therapies that appears to be highly effective against aggressive forms of childhood cancer, such as neuroblastoma. Here's Professor Michelle Haber, who's the Executive Director at the Children's Cancer Institute. Michelle, thank you for joining us. Firstly, to the types of cancer that we're talking about. They're high risk. Right now, what would a newly diagnosed child and their parents be told about what would happen from here on out in terms of their treatment and the risks are and what they can expect?
Neuroblastoma is the commonest solid tumour of young children, and when a child is diagnosed with high-risk neuroblastoma, which means that there are certain genetic features and clinical features which make it likely to be resistant to therapy, that child is told that they're only likely to have a 1 in 2 chance of survival. Now, that contrasts dramatically with the overall survival rate for children's cancer, which has increased dramatically over the last 60 years ago, from 0 up to over 80% today. But for neuroblastoma, which is not a brain tumour as many people think, it's actually a tumour of the nervous system. It actually presents as a lump in the abdomen, and the child will be told that they will have intensive chemotherapy, radiotherapy, surgery, immunotherapy. They will be treated within an inch of their lives, literally, to try and eradicate the tumour, and yet despite that, half of these tumours do not respond to therapy. And the drugs that are given are actually very toxic to these children, and even the ones who survive have a significant chance of late effects, which can be lifelong and life-threatening. So we really need safer and more effective treatments.
Yeah, so it's really high stakes, obviously, what you're dealing with. How does this new combination of therapies work?
So we're quite excited about this. There are 2 drugs. They're both relatively new types of drugs. The first one is one called CBL0137. It's from a new class of drugs called curaxins. And unlike standard chemotherapeutic drugs which damage the DNA, and it's that DNA damage that is actually responsible for the side effects in the normal growing tissues of the child that will give them these lifelong late effects. In contrast to that, CBL0137 does not damage the DNA, and it in fact acts by disrupting the protein DNA complex that forms the structural arrangements in our chromosomes. We then thought that if we combined that with another class of drugs called histone deacetylase inhibitors, or HDAC inhibitors, and a prototype of that is panobinostat, which also damages that complex of DNA and protein, but does so, or affects that complex of DNA and protein, but does it in a different way from CBL0137. We thought that maybe when we put these 2 together, we would get synergy and we would get a greater anti-tumour effect. Now, both of these drugs are actually in clinical trials for adults as single agents currently, and panobinostat is in trial for children as well, and CBL0137 will go into trial in children later this year in an international trial led by our group. So we thought that if we put them together, we would see what happens, and then we had a pathway to clinical translation of this combination. Well, the results that we saw were remarkable. In our laboratory models of neuroblastoma, we saw complete and absolute regression of tumour growth. All of the tumours in all of our model systems regressed completely and with minimal side effects. And interestingly, we saw an activation of the immune system in the tumour cells, specifically in the tumour cells, where the immune cells of the body that can fight the tumour were harnessed into the tumour, which suggests that this was contributing to how we were getting this marvellous response in these model systems. So we're very keen to take this to clinical trial.
Yeah, I can see why. So it's looking very positive at this point. And of course, any improvements that you make in this area can mean that families don't lose a child. So it's such a huge motivating factor for your work.
It absolutely is. I've been in the field of childhood cancer for nearly 40 years. Survival rates used to be dismal. They're so much better, but even now, childhood cancer is the commonest cause of death from disease in children in this country, and every week 3 children still die of cancer. So despite fabulous progress, we've still got a long way to go, and it's all about having safer, more effective therapies. And we are really very excited that what we've got here is a new way of treating children, not neuroblastoma, but we've been thrilled to see that this same combination also works in some of the other highest risk childhood cancers, high-risk brain tumours, high-risk leukemias that occur in infants, as well as the high-risk neuroblastoma. So it seems that this combination is attacking a target that is specifically present in these childhood cancer cells, in these very primitive, undifferentiated cells, is sparing the normal tissues in the body and is sparing the children from the poisons that standard chemotherapy actually is for the growing tissues of a normal child.
And Professor Haber, is using more than one therapy becoming an increasing focus of research?
Oh, absolutely. Combination therapy has been the reason that childhood cancer survival rates have increased so dramatically, and actually adult cancer as well. Combination therapy is the mainstay of cancer treatment because tumours can become resistant much more easily to the action of a single drug. If you combine them with another drug, they find it harder to mutate in such a way that they can resist the action of both drugs. And in fact, often it's multiple combinations of 2, 3 or 4 drugs. And we believe that our data showing the immune response suggests that this is waking up the immune system in these tumour cells, and that a further combination of CBL and either panobinostat or a drug of the same class of panobinostat combined with immunotherapy in the future may give even more resilient and robust responses going forward. So yes, this is the way of the future.
Professor Michelle Haber, Executive Director at the Children's Cancer Institute, thanks so much for joining us.
It's a pleasure. Thank you for having me. Bye now.
It appears